Q21, Honourable Member Mr Thomas.
Thank you, Mr President. I beg leave to ask the Chair of the Health and Care Transformation Board, pursuant to the statement by the former Minister for Policy and Reform in February 2020, when he expects the transformation programme will identify options and then implement a new financial model for care homes.
From the Chair of the Health and Care Transformation Board, Mr Ashford.
Thank you, Mr President, and can I start by thanking the Honourable Member for Douglas Central for this question on the statement that he himself made in February this year. As the Honourable Court is aware, the work of the future funding of nursing and residential care was joined with the Health and Care Transformation Programme in 2019, following Sir Jonathan Michael's recommendations and the interrelationships between both the service provision and the financial modelling between this component part of the health and care system and the rest. As advised by the Honourable Member for Douglas Central to this Honourable Court in February this year, the Transformation Programme will identify options and recommendations and seek approvals for future funding of health and care services, including care homes, by April 2023, and implement a new financial model, again including care homes, by September 2024. I can confirm that the programme is still working to these timescales, and the work will necessarily include service options around the model of care, of how nursing and residential care is provided, and whether there need to be a change to this, and funding options around how nursing and residential care is funded and paid for example, whether all care should be provided free of charge by government, whether there should be some form of social insurance, or one of a range of other options. It is clear that the desired service option may impact the pros or cons of any new funding model, i.e. if the new service model would result in more people staying at home longer and thus reduce or delay those entering care homes, and as such the funding model should take these considerations into account. Both these areas will require full consideration of the options, followed by a decision to select an option and then implement that option. The size of this task in terms of service options and funding options is considerable, and also must be considered as part of the wider provision of health and care service and the wider funding of health and care, and indeed public services in general, Mr President.
Supplementary, Mr Thomas.
Thank you, Mr President. So could the Minister agree with me then that it would be slightly disingenuous to pretend that the timetable had been brought forward in any way, as I actually heard a senior member of government doing recently when wound up by the Manx public? And secondly, would the Minister comment on the recommendation made to me back in February 2020 by Mr Robert Shaw, which was that the narrative in a general election year, with the greatest of respect, saying 2024 for this issue that's been around for decades, is actually a bit frustrating. It sounds like it's a long grass job yet again on the funding of residential and nursing care.
It's very difficult to hear, when, Honourable Member, when you're addressing the far corner of the chamber. If you could direct your voice towards the chair. Mr Ashford.
Thank you, Mr President. First of all, Mr Robert Shaw did indeed, during the debate in February, mention about moving into the election year and the fact that there is obviously with dragging it out, it is difficult. I would remind the Honourable Member for Douglas Central what he actually said in response, where he actually said that the narrative is quite clear, which is the current offer has been improved substantially as it stands. And I would also remind him of his other words, where he said that transformation is of the whole system. Transformation needs to be a deliberate planned process that sets out an aspiration to make integrated and radical changes to processes, behaviours and responsibilities, and that should result in substantial, measurable improvements in outcomes. I don't think I could sum it up any better than that myself.
Supplementary, Mr Quine. No. Mr Thomas.
Thank you, Mr President. So would the Minister agree with me then that the 6 options presented to this Honourable Court in a well-written report in July 2018 are the options that are on the table, and the next administration at least has to have the guts to actually challenge itself and actually increase social care contributions if that's what's necessary, and change the system profoundly?
Minister to reply.
Thank you, Mr President. My personal views are very clear. The system does need to be profoundly changed. There are 6 options on the table which have been discussed in this Honourable Court. The timescales we're working to are exactly the timescales that the Honourable Member for Douglas Central laid out in his statement in February. He said in reply at that time to Mr Baker, I think it was, the Honourable Member for Aaron Ramsey, that the engine has not stalled. Well, I reiterate his words, Mr President, the engine has not stalled. We are working to the timescales that were laid out very clearly by the Honourable Member for Pursuant.